I'm Dr. Worden. Welcome to Health Hot Seat, the show where conventional and alternative medicine go head to head to bring you the truth about important medical topics. Why is it that cardiovascular disease is so prevalent?
I think a lot of this has to do with the way we eat, how we exercise, how we fundamentally don't take care of ourselves.
Dr. Thames is right, it's a lifestyle disease, but we live in a toxic environment right now.
How many times have you worked with patients that they were right? They were right or you were right, you just had that moment because you were listening to that intuition. I think that's a big part of medicine that we're missing, and it doesn't have a double-blind placebo, it never will.
It's nice to make these claims, but I think I like to see the science behind these kinds of things, and I haven't seen it.
Dr. Thames has given the mantra that I've heard for 30 years.
Who do we listen to? The American public and primary care physician sitting here. How do I know?
I don't think you know.
Where do I go? Right. Where do I go to even find the statistics that you're talking about, and do I just trust what you're telling me?
If you look at the Vioxx disaster or the Celebrex disaster, and when the FDA started to really put these studies under a microscope, after 2005, there has really not been any good studies on statins and coronary disease.
There have actually been some clinical trials done since 2005. My own view is that lowering LDL cholesterol is very important for reducing the risk of a recurrent myocardial infarction.
When you prescribe a statin, do you also prescribe CoQ10?
No. Without information to support it, in my view, is not good medicine.
So do you consider books on supplements and books on not good medicine?
I don't read them.
So how can you judge them?
There's a middle ground here, and this is what doctors need to do. They need to do their homework. They need to do more reading. They need to take the blinders off. They need to say, look, if I'm going to use pharmaceutical drugs, I better teach myself or learn more about nutrition.
How will the patients know that they're getting a quality supplement, something that won't harm them, even though it supposedly has no side effects because it's a natural substance, but it may be harming them?
But I have to tell you, I mean, I've been using supplements for almost 40 years. I mean, I don't see the problem. I really don't. Look, the fourth leading cause of death in America today is properly prescribed pharmaceutical drugs.
You look at the multi-billion-dollar industry in this country in multivitamins, okay? A huge percentage of the vitamins that someone takes in a multivitamin goes out in their urine.
Correct.
It never gets absorbed.
So I want to take a point that you said a minute ago about nutraceuticals not having any side effects. I would take some contention with that myself.
Vitamin K2, metaquinone 7, literally takes calcium out of blood vessels where it doesn't belong, and it puts it back into your bones where it does belong. So vitamin K2 is a very, very interesting, nutraceutical.
And I think that this idea that, you can just come up with these ideas and, oh, this all fits together, it makes a nice story, let's just do that. Without information to support it, in my view, is not good medicine.
If it's preventative at some point and no side effects from it, I don't understand why that wouldn't be in the thought process.
So that means that you have to treat 15 patients to prevent one of them from having muscle discomfort.
I'm more than muscle discomfort.
You know, you're such a prince of a guy, but what I hear you over there is almost like the tobacco industry. 30 years ago when we said that, that they were telling us that, smoking's okay, and it took 30 years to get the data out.
Here's the placebo effect, here's the medication. A lot of times they're pretty close.
And I think we need to be careful about magical thinking that we're getting something in a multivitamin that's really going to impact our health in the long term.
I like to bring science to the table, but basically I don't think you should cut out, not read the nutritional books or not read the books on supplementation, because remember, if they're written by credible people with certifications that you and I both have, and there's a bibliography in the back citing the randomized trials, why not read them? I think you're living your life with blinders on, and that rigidity can come back to bite you.
Perhaps it can, but I'm prepared to live with that.
Ultimately, you write your own prescription for health. See you next time on Health Hot Seat.